Hi, my name is Alex Fisher, and I'm a Director of Advanced Global Health and here to talk about the WID-Easy test for endometrial cancer. Each year, 300,000 women will visit their GP with postmenopausal bleeding, and nearly all will be referred to secondary care for a cancer assessment. In the end, 3% will be formally diagnosed with endometrial cancer. Currently, ultrasound sonography or imaging is used to triage these women. For Black women, the sensitivity of imaging is less than 50% and the specificity is only about 65%. For white women, the sensitivity is better at between 85 and 90%, but the specificity is poor at less than 45%. This means we could not only be missing a large number of cancers, but it is also leading to a high number of false positive results, which translate into unnecessary procedures. To overcome this challenge, experts at University College London have developed the WID-Easy test to triage women with abnormal uterine bleeding. The test measures the methylation status of two DNA regions, which are known to be highly methylated in the presence of endometrial cancer. The test is very simple. It involves a basic cervical vaginal swab test, which can then be transferred to a local lab at room temperature. Using PCR technology, the methylation of the DNA regions or the sample are assessed, and a result can be transferred back to any healthcare institution within 4 days. To date, there have been 8 peer-reviewed studies assessing the test, and as you can see in the green box, the sensitivity has been excellent in all studies and the specificity has remained very high, indicating the test is great at identifying cancers but also effectively ruling it out. In the most recent large study published in Lancet Oncology, 400 women that were referred to University College London Hospital were assessed. If we look at standard of care, which is imaging, for every 100 women that participate in the study, 28 women were deemed to have positive imaging and therefore be at a higher risk of cancer. But 25 out of those 28 did not go on to have cancer. If we look at the WID-Easy test for each 100 women that were assessed, the test turned positive on average in 5.5 women, and less than 3 of those women would have been a false positive result, resulting in a 90% reduction in false positives and therefore unnecessary procedures. The WID-Easy test is therefore a revolutionary, affordable and comfortable diagnostic test that has shown to reduce unnecessary procedures by 90%. The most common diagnostic procedure is a hysteroscopy and biopsy, which currently costs the NHS £2,700 per event. Of the 300,000 women that visit their GP each year, up to 100,000 undergo these diagnostic procedures. The WID-Easy test can therefore transform the diagnostic pathway in both primary and secondary care. The test is available throughout the private market, and we are looking to work with ICBs and trusts throughout the country in partnership with local cancer alliances to implement the test.